Hi, my name's Liz Fergus. I'm called Elizabeth by my family, and I'm a diversity and inclusion project manager in an adult social care department in the east of England. I co-wrote my chapter with my colleague Nyasvimbo, who is a data analyst in the same department, and also a co-chair of our department's diversity and inclusion board. Neither of us are social workers, but we've both worked in social care and in our department for a long time, and we care about the work and the environment for all social care practitioners. Our chapter is called The Creation of an Anti-Racist Organisation in Social Care. And what I'm going to do is read a few extracts from the bit of the chapter that I wrote, just documenting some of the work that we've done in our department to create an anti-racist social work department. So I start with how it was when I started in social care. So I first started working in the social care department in 1990 in an administrative role. I didn't really have any idea of what social services did, but was keen to learn. Once I joined, the person who appointed me commented that she hadn't expected me to be one of the people she interviewed, as I have a typically sounding European name and I had some academic qualifications. The Black young people she knew were through her pastime as an athletics coach and a referee. I didn't know how to react to that, and I'm not sure what I did or said at the time. But I remember that comment some 30 years after it was made. Perhaps my new manager, whom I liked and got on well with, expected Black youngsters to have athletic ability, but hadn't expected they could pass exams. How is it now? The department I work in now, where 24% of the workforce is from a marginalised background, is hugely different to that I first experienced. It's been interesting living through and witnessing this change. I've had my fair share of difficult experiences and encounters in work over the years, from the comment made soon after joining to having a new colleague initially laugh in disbelief when another colleague told him I had a master's degree, to colleagues asking where I was born or commenting on how I speak, to outright racism, with people not realising I'm Black, telling me they don't want Black people providing their care during phone conversations, or making disparaging remarks about the Black care workers they have. The next section I'd like to read is titled Unwelcome Catalysts. And it says, the disproportionate impact of the pandemic and George Floyd's murder were unwelcome catalysts for conversation and action. Life can be harder when your skin isn't white. And while I know and understand some of the historical foundations of this, I can't understand why or how the colour or shade of a person's skin or their cultural, ethnic, religious, sexual or gender identity can lead others to think that they are less human or worthwhile. Yet that's what racism does. It causes immeasurable harm. In the last 2 years, particularly since 2020, I've had conversations about race with colleagues that I wouldn't have previously dreamed possible. There are colleagues I trust with whom I've been able to speak with openness and honesty about some of my experiences. Then move on to leadership and why we're doing this. As a Black woman, my role is full of opportunity and challenge. It's exciting and daunting, almost in equal measure. It's high profile, and with that comes risk. Our director and the senior management board are clear that anti-racism must be a top priority because social care is about human rights and social justice. They recognise racism and systemic racism are among the most insidious, complex and challenging forms of discrimination to tackle. As a social care service, we work with people and can have profound and far-reaching impact on their lives. Recognition that everyone has equal worth and should be treated in an equitable way is integral to our work, and this must extend to our workforce. I then move on to a section that's about developing our action plan and the steps that we've taken. starting with workshops. Listening was the start of developing our action plan, and I've sought to engage with and listen to what colleagues have told me about their experiences. I thought it important to create and enact our plan with the people who would be most affected and who would be making its aims a reality. Survey. An in-house survey in 2019 informed initial development of the action plan. The survey found that staff who were minoritised by their skin colour were more likely to report negative experiences in access to training, development and progression, as well as discrimination from people they were working with. This same group were also less likely to feel a sense of belonging than most of their peers. Action. At each stage of developing the action plan, I have asked colleagues for feedback. Now we have colleagues working with workstream leads from our senior management board to work on actions identified as priorities, including creating a toolkit of material to support action on diversity and publishing a charter and creating a network of diversity guardians roles to provide informal support and promote diversity. And I'll end with the future. My hopes for the future are that all of us in social care continue this work, because when it stops being a focus, it stops happening. I hope people see change as positive and join in. I hope minoritised colleagues won't continue to face barriers to progression, but will be recognised for their ability and able to progress and achieve their potential in the same way as others do. We all have race and ethnicity, and we are all, some of us more directly than others, affected by racism. I'm glad to be working with colleagues on making a small contribution to tackling racism in this corner of society. Thank you for listening.